Kwe, Tanse Ulukut, greetings, bonjour, Sego. I would like to begin by acknowledging that Canada's Parliament, where we are today, is situated on the traditional territory of the Algonquin people. As of August 11th, we are aware of 425 confirmed cases of COVID-19 for First Nations on reserve. Of these cases, 34 are being hospitalized and 393 have now recovered. There is also a total of 17 confirmed positive cases in Nunavik, Quebec, all of which have recovered. Indigenous Services Canada continues to work closely with Indigenous communities and their leadership to make sure they have what they need to prepare for and prevent the spread of coronavirus. This includes quickly processing personal protective equipment requests as effectively as possible to help communities stand ready to respond to COVID-19 and to ensure the safety of healthcare workers and others supporting the delivery of healthcare services. As of August 11th, Canada has shipped 1,051 orders for PPE, including hand sanitizers, N95 masks, isolation shields, and gloves. I would stress that this does not include the shipments made by First Nations Health Authority in British Columbia, as well as provincial territorial shipments and individual purchases made by communities. La pandémie de COVID-19 a posé des défis imprévus à tous les Canadiens. Nous avons tous été touchés par cette crise, les individus, les entreprises, les communautés. Tous ont subi des pertes. Les Premières Nations, Inuit et les Métis sont parmi les plus vulnérables au Canada. Tout au long de la pandémie, ils ont été confrontés et continueront à être confrontés à des défis uniques, souvent exacerbés par les inégalités sociales et les barrières systémiques. Canada recognizes this and the strong role of Indigenous leaders. They and their governments, organizations, are and have been best placed to determine the needs of Indigenous peoples and to develop community-based solutions to respond to these challenges. It is a testament to Indigenous leadership and indeed Indigenous peoples that community exposure to the virus has been limited. We want to continue to support their strong pandemic management and to ensure that Indigenous leaders have the tools and support they need at their disposal to implement various aspects of their pandemic plans. That was the impetus for the creation of the Indigenous Community Support Fund that was announced March 18th, in which to date has allocated $380 million in new funding to Indigenous communities and organizations. Today, as we continue to navigate this pandemic and to keep Canadians safe, I'm pleased to announce that Indigenous Services Canada will provide $305 million in additional allocations to communities from the Indigenous Communities Support Fund. This funding will provide crucial support to key community initiatives that strive to prevent, prepare for, and respond to COVID-19 in First Nations, Inuit, and Métis communities. It'll be distributed through a combination of allocations directly to First Nations, Inuit, and Métis leadership and needs-based funding that will be application-driven. This approach aligns with our commitment to support Indigenous leadership's approaches to community wellness while providing the flexibility to respond to emerging needs, for example, in response to an outbreak of COVID-19. This is something we have heard directly from Indigenous communities. This funding will also be available to organizations living off reserve and Inuit and Métis living in urban centers on an application basis, and further details relating to this will be forthcoming. Le Fonds de soutien aux communautés autochtones aide les organisations et les communautés dans leurs efforts pour répondre à divers besoins, notamment le soutien aux aînés et aux membres vulnérables dans les communautés, des mesures visant à lutter contre l'insécurité alimentaire, le soutien éducatif et autres pour les enfants, l'assistance en matière de santé mentale, services d'intervention d'urgence, bien évidemment, et préparation et actions supplémentaires pour prévenir la propagation et l'éclosion de la COVID-19. L'aide engagée jusqu'à présent par le biais du Fonds de soutien aux communautés autochtones fait une différence pour des centaines de communautés autochtones du Canada et pour environ 260 organisations et communautés autochtones qui servent les populations autochtones dans les centres urbains et pour les membres des Premières Nations hors réserve. For example, this funding supported flood security for First Nations in Alberta by facilitating on-the-land activities for Treaty 8 nations, enabling families to access traditional hunting and gathering places. It also supported the purchase of new equipment and rainwater harvesters. Beaver Lake Cree Nation in Alberta used their funding to build 50 community gardens, one for every elder in the community, giving community members the opportunity to work alongside one another and improve community mental health. In the Atlantic region, Abegweit community councils leveraged their funding to support 57 families and 90 individuals living off reserve. Including today's amounts, the Government of Canada has committed over $2 billion in funding specific to Indigenous and Northern communities and organizations. First Nations, Inuit, and Métis have also access to other measures provided through the Government of Canada's COVID-19 Economic Response Plan, and I encourage everyone to review the plan for other financial supports that may be available to them based on their situation. Nous continuerons à travailler en partenariat avec les communautés et les organisations autochtones pour soutenir une réponse forte et globale à cette pandémie. Ce financement représente un soutien concret aux solutions communautaires sur le terrain qui répondent aux besoins et aux circonstances uniques des Premières Nations, des Inuits et des Métis. Miigwech, merci, Nakumik, thank you, merci. Je suis maintenant prêt à prendre des questions.
Question des journalistes, une question et une question de suivi. We'll now take questions from the journalists, one question, one follow-up question. Nous commencerons par les questions par téléphone. Pour ceux qui sont dans la salle, nous vous demandons de vous diriger vers les micros. We'll begin with the questions over the phone. For those of you in the room, we ask that you please make your way to the mics. Operator, over to you.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Et la première question, the first question is from Michel Lamarche from TVA. Please go ahead. La parole est à vous.
Bonjour, M. Miller. Je vais vous poser une petite question. Il y a les résultats d'un sondage léger qui, au moment où vous vous adressez à nous à Ottawa, sont publiés à Montréal. Et il y aura un dialogue qui sera entrepris entre les Québécois et les Premières Nations au Québec. Dans le sondage, on voit notamment là, qu'il y a une majorité de 92% des Québécois qui pensent que les Premières Nations font l'objet de racisme. Qu'est-ce que vous pouvez faire, vous, au fédéral, pour contribuer à ce dialogue? Et qu'est-ce que vous pensez de cette donnée qui est, ma foi, étonnante?
Merci, Michel. Et vous m'apprenez les résultats du sondage à l'instant même, donc je n'ai pas eu l'occasion de réviser les résultats. Ce n'est pas quelque chose, ceci étant dit, qui me surprend, étant donné la fenêtre qui m'a été entrouverte aux Premières Nations par le biais de la position que j'occupe en tant que ministre des Services aux Autochtones. Je parlais à des intervenants à Montréal hier qui servent les communautés autochtones vivant dans les communautés urbaines, notamment Montréal. C'est un phénomène, une réalité qu'ils vivent au jour le jour, que ce soit les approches dans le système de santé, les interventions policières. Je passe une bonne partie de mes journées à combattre, à lutter contre l'ignorance qui persiste au Canada dans les communautés non autochtones en ce qui a trait à notre histoire partagée. C'est quelque chose qui empêche le progrès dans nos dossiers, malheureusement. Si tout le monde pouvait vivre une ou deux journées de ce que je vois personnellement dans l'interaction que j'ai, qui est très valorisant, mais qui peut être très pénible en termes d'interaction et de dialogue qu'on peut entretenir, je pense qu'ils seraient tous sur la même longueur d'onde et je pense que les résultats en témoignent. On a une pente assez raide à remonter au Canada en ce qui a trait au racisme systémique, le legs d'instances coloniales qui persistent. Ça prend une réflexion, ça prend une ouverture d'esprit, très franchement. Je pense que les Canadiens sont prêts à le faire, les Québécois sont prêts à le faire. Nous sommes, on se dit un peuple très ouvert au monde, mais encore faut-il être très ouvert aux Premières Nations, aux Inuits et aux Métis. Et la première réflexion qu'il faut avoir, en est une d'ouverture, d'accueil et d'être chaleureux envers les uns les autres, mais d'avoir des discussions très franches et de ne pas avoir peur de faire des erreurs en parlant, puis de continuer de forcer le dialogue. Mais pour répondre directement à votre question, Michel, dans les résultats que vous m'apprenez à l'instant même, ça ne me surprend pas.
Mais Qu'est-ce que vous m'entendez? Qu'est-ce
Oui,
que
oui.
vous pouvez faire, vous, au fédéral, pour contribuer à ce dialogue? On dit aussi qu'on trouve que Québec n'en fait pas assez pour améliorer cette relation. Est-ce que Québec a aussi son rôle à jouer? Là, on sent que toutes les parties sont prêtes à entreprendre un dialogue pour que la situation s'améliore, soit modifiée, évidemment, pour le mieux.
Ben, la peur et le racisme passent d'abord par l'ignorance. Et il y a un problème très difficile d'éducation. C'est pas une question d'interpeller sur la place publique des instances gouvernementales, mais un processus à long terme d'éducation, d'ouverture. Ça passe par la législation sur le droit des peuples autochtones, que ce soit au niveau provincial ou au niveau fédéral. Je vous rappelle que le droit fiduciaire envers les peuples autochtones, c'est un devoir qui incombe aussi aux provinces, tant au fédéral qu'aux provinces. Évidemment, avec la responsabilité primaire qui revient au fédéral, mais c'est un droit fiduciaire, c'est un droit d'abord de respect, d'accueil, de coopération, de partenariat. On a du travail au fédéral à assurer que les peuples, que l'écart socio-économique, et dans mon dossier en particulier, que les écarts socio-économiques qui existent entre les peuples autochtones et les peuples non autochtones soient nivelés. Sachez que si on se situe au Canada 5e ou 6e au monde en termes de développement socio-économique, les peuples autochtones, eux, se situent au 60e à peu près, au 60e rang. Alors, il y a un écart qu'il faut combler. Ça passe par des investissements en infrastructure pour pallier aux sous-investissements en capital. Ça passe par l'éducation. Ça passe par un discours ouvert. Ce cheminement qu'on fait au niveau politique est très incomplet et en fait sera raté si cette éducation et cette ouverture d'esprit n'existent pas entre les particuliers qui ne sont pas nécessairement politiques, qui ne passent pas leur journée à parler d'enjeux autochtones en tant que tels, mais vraiment une ouverture d'esprit envers les peuples autochtones, peuples fondateurs du Canada.
La salle, we'll now take questions from the room.
Minister Molly Thomas, TTV National News. You talked about the 425 cases on reserves. Are there specific hotspots that you're most worried about, and why?
We had recently been worried in particular. So the answer is yes, exceedingly worried. We had recently been quite worried about the spread in Haida Gwaii. Whenever you see numbers starting to go up, these things can go exponential quite quickly. As always, leadership on the ground has reacted tremendously through basic hygiene protocols that we've been stressing from the very beginning, and we are cautiously optimistic about the developments in Haida Gwaii. It's a very sensitive area in terms of its ecosystems, in terms of its peoples, and it is. It is an area that is very, very vulnerable because in part of its remoteness, but also because of its exposure to tourists. This is a worry that we see when we talk about second waves or third waves, the progressive openings and staged openings in provinces to the economy, people letting their guard down. We know with historic pandemics that Indigenous peoples, and I generalize across the world. I recently had a discussion with the Minister of Indigenous Affairs in New Zealand, who is Maori, and who stressed that much like Canada, second waves have hit their peoples much more severely than first waves. This was, the pale comparison that we have is H1N1. We also have much older references with respect to the Spanish flu, but we know that there's no magic about COVID-19 going away until such time as we find an effective vaccine and a penetration level of the vaccine that allows people a level of immunity. So it hasn't disappeared, and that vigilance that we reinforce and the funds that we attribute to ensure that communities have the resources they need are very, very much important. We know recently with the Siksika, where they were tracing, they had a few dozen cases, active cases, but they were tracing about 200 people, and that contact tracing within the first couple of days is so essential to stomping out the virus. And they've done an exceedingly good effort. And Chief Ulrich Crowfoot has been very good with his community members to remind them that there are no people have freedom of choice, but not freedom of consequence. And spreading within a community is something that is very, very worrisome to them, particularly since they both are very close to the U.S. border, but close to an urban center. And these are ever-present concerns that will continue to be ever-present until such time, as I've said, we find an effectively deploy a vaccine.
My other question is a different, I guess, subject area. I'm curious about Red Lake. Of course, there's a wildfire burning there, Red Lake, Ontario, and more than half the population is Indigenous, and people have already had to be evacuated. So is the federal government targeting emergency funding towards the Red Lake community?
Yes, and this touches on your earlier question. As with the flood season, COVID-19 makes the potential evacuations much more complex in respect of Red Lake and Ibmatong as well. There are a few hundred acres that are under active, that are on fire and are at various levels of control. And indeed, the latest update I got this morning is that our team has touch base with local leadership to ensure that we're providing the supports and providing the proper evacuations protocols to ensure that people stay safe. Again, it is a little more complex because of the fear of COVID-19 and the vulnerability of the local populations. But so this is very much a situation that is under active surveillance by our team.
But is that emergency
and
funding?
when you talk about it's emergency management in conjunction with the province, but when you talk about the supports that we would provide at Indigenous Services Canada, it would include additional resources to ensure that people stay safe.
David Thurton, CBC News. So can you tell us which communities in particular you're assisting? We've heard that there have been evacuations in Fort Hope and Abamatong.
Yep.
First Nations. So can you confirm whether the federal government is helping with evacuations in these First Nations communities and which ones in particular?
We are, and the two ones that I think you referenced are Red Lake and Ibmatong, Fort Hope. And we're actively monitoring the situation and providing the support in conjunction with the province.
So you're providing support. Is that support?
Well, when
for
you look at the emergency
evacuations?
support protocols, it includes the resources that are provided by the province. So we have an emergency coordination group that I'd be glad to brief you on as to how it works and how it operates. Again, as we much like the situations we faced with flooding, it is a joint operation that we perform with the province and their emergency services management. Again, heightened because of COVID.
So are you assisting with evacuations in these communities? Yes, you are. Okay.
Yes.
So finally, my question is, I just have a quick question about UNDRIP. Your government has pledged to bring legislation, federal legislation on this. Obviously, the situation has changed since you made that promise. Can you give us an update on that? Is that still a priority for the Liberals?
Just what do you mean by the situation has changed?
Well, COVID-19.
Oh, if you mean the setup that we have at Parliament for adopting legislation
Yes,
that is
exactly.
only okay,
Yes.
Yeah, sure. We're committed to presenting UNDRIP legislation and the time in the shortest possible time frame. Obviously, the situation that we have with COVID and the agreements that we've had with all parties to only introduce legislation that pertains directly to COVID-related measures is the agreement we've had with every single party in the House to ensure we keep the structure that we currently have. And as we resume Parliament, then we would revert to what we've been doing normally, which is the agenda that we have set out and is described most notably in the throne speech and in the various mandate letters. And it still remains an utmost priority of the government to ensure that UNDRIP is put forward, particularly in the light of the events that we have seen in the last few weeks over rights of Indigenous people, and it is really under the purview of Minister Métis. But the timing of that introduction is not something I'm at liberty to discuss publicly.
Okay.
It isn't. If you want to know whether it remains the utmost priority of this government, the answer is yes.
Retourner au téléphone. We'll now take more questions from the phone.
The next question, la question suivante, est de Paula Newton de CNN. La parole est à vous. Please go ahead.
Hello. Thanks for taking our questions today. Minister, we discussed this certainly a couple of months ago, and it was about the mental health people in Indigenous communities following COVID, but specifically among youth, and the fact that we had already been dealing arguably with an epidemic in that anyway over the last several years. Anything more you can tell me about the government's efforts in this area going forward, especially as perhaps there's been some kind of a release valve on the pressure in the last few months, but that obviously, as you just explained, you have to remain vigilant as there could be certainly a second wave of COVID and perhaps more lockdowns to come.
That's an exceedingly important question, Paula. And you know what we have been unable to fully appreciate and quantify up to now is the full impact of what is the mental health of Indigenous peoples, in particular, and indeed all Canadians. As we know with previous pandemics, the effects of these pandemics on mental health of people in particular. Perhaps those most vulnerable, and this is something that I find is very important to stress, even though Indigenous communities went into this pandemic much more vulnerable, and indeed across America, much more vulnerable to COVID. They have responded in a magnificent fashion. The impact on mental health, the impact on youth, perhaps a growing, and in Canada, a growing segment of the population compared to non-Indigenous youth. Has been great, and it's difficult to understate that impact. We see it on the demands under Jordan's principle, which strives towards substantive equity between non-Indigenous and Indigenous youth, and the demands that we felt on our department, particularly on mental health. It is a very large portion of youth, and it is a very large portion of my budget. And as we've seen with recent reports, most notably coming out of BC over the use of opioids, substance abuse, and the impact disproportionately on Indigenous people, those that have succumbed to it, is an instance and an example, an acute example of the impact on the mental health of Indigenous communities, and particularly on youth. On reserve, which is the primary policy area of First Nations Health Authority, which comes under my ministry. Those harm reduction models that we put forward and fund are key to ensuring that people stay safe, both physically, but also mentally. And one of the lessons that we've learned through the rapid deployment of funds and resources on the physical health, but also the mental health of Indigenous peoples, is some of the solutions that have been put forward to us by communities. It is not a rule everywhere, but one of the examples comes directly from Indigenous leadership and Regional Chief Yakalea pushing the on the land options to ensure communities reconnect with the resources on the land using Indigenous knowledge. And that is something that has had a resounding positive impact on people's mental health. We know the impact that use and abuse of alcohol, for example, and the need to continue with the harm reduction models that we have, and that indeed all Canadians and all Canadian governments should put forward in treating these things, and to avoid stigmatizing, because it is so key in having a health response to what is in effect a health problem. In terms of resources, which I think may be a follow-up question or a natural follow-up to what you're asking, we continue to work to assess mental health needs and ensure that resources, financial foremost, are deployed to treat directly the growing mental health concern, which we still can't quantify entirely or acknowledge and measure the impact of. And I think we won't know for a number of years what that impact actually was.
Was that your follow-up question?
Yes, it's answered. We'll just continue to follow up with this in the next few months, Minister. Just one other thing on this issue. And as you know, and I know you're speaking to communities, and I was glad to hear you mention the land-based solution. Certainly, returning to culture. In terms of more granular programs that teenagers that I've reached out to are looking for? Is there anything coming?
The answer is yes. Timing and scope has yet to be identified. I recently was participated at least by Zoom with health leadership from Métis organizations and then separate ones with Inuit organizations, and recently, as a couple days ago, with First Nations leadership, particularly and especially on mental health. We received some incredible presentations on the work that's being done, the solutions that are being offered, the helplines, the results of some of the helpline data, which might be helpful for these questions, might be public, and I'd have to look into them. But they're both alarming, but they also show the importance to support these helplines, to have mental health, obviously cognizant of the challenges of being physically present, particularly in remote communities, but also because of the health challenges. But they testify in general to the ongoing need of assessing, reassessing, and re-engaging, and making sure that local leadership has the strongest voice in ensuring that the solutions are properly tailored to communities as they struggle with this ever-present problem.
Thank you. Operator, next question. Prochaine question.
The next question, la question suivante, est de Dennis Lord from Radio Taiga. Please go ahead. La parole est à vous.
Bonjour, Monsieur Miller. Est-ce que vous pouvez me dire quelle somme de ce montant-là qui est dévolu pour les Premières Nations des 3 territoires?
Vous me parlez du 305?
Oui.
Qui vient d'être annoncé aujourd'hui. Écoutez, Dennis, c'est la formule va rester sensiblement la même que celle qui a été utilisée, qui a été employée lors du premier volet de financement que nous avons annoncé en début avril ou fin mars, je me souviens plus. Ça suit une formule qui tient en ligne de compte de la population, de la communauté, la vulnérabilité, l'index de santé dans la communauté qui se fait à travers des sondages périodiques et un facteur d'éloignement. Encore, il y a un volet additionnel qui fait suite à beaucoup de revendications ou beaucoup de critiques positives, constructives qu'on a reçues suite à l'allocation. Souvenez-vous que l'idée de la première enveloppe, c'était de déployer des ressources financières qui répondaient aux besoins criants des communautés pour qu'ils puissent déployer des mesures sanitaires dans le plus bref des délais. Cette fois-ci, nous avons pu digérer la rétroaction qu'on a eue des communautés en ce qui a trait notamment aux besoins particuliers de certaines communautés, le besoin d'avoir une sensibilité à des demandes qui seraient directement par application. Et donc, je vous donne une réponse incomplète parce qu'on continue nos discussions pour savoir comment et quand ce sera au plus vite possible, mais comment déployer l'argent de façon sensée qui fait suite à la rétroaction qu'on a eue suite à la première enveloppe. Mais si votre question était si on passe par les territoires ou les provinces, la réponse est non, l'argent va directement aux communautés.
OK. Non, ma question concernait plus le montant global. Il y a eu une augmentation de la violence et de différents problèmes pour les femmes dans le cadre de la COVID. Est-ce qu'il y a des montants qui sont dévolus spécifiquement pour aider les associations de femmes autochtones?
La réponse, c'est oui, mais j'ai une réponse à plusieurs volets. C'est un constat de société au Canada qu'il y a eu une augmentation dans l'achalandage, dans l'utilisation des foyers pour femmes et enfants principalement. La violence conjugale, où on a assisté à une croissance de ce phénomène, de ce fléau de société. La ministre Monsef avait auparavant annoncé plusieurs sommes d'argent pour attaquer les besoins créés en infrastructure, en appui à travers le Canada. Nous avions, il y a 2 mois, annoncé 50 millions pour des foyers sur réserve. ainsi que le volet que Mme Monsef ou le ministre Hussein avaient annoncé dans le programme Vers un chez soi. On prend acte, évidemment, de ce qui se passe. La violence conjugale, on ne peut pas nier son existence et évidemment la vulnérabilité causée par la COVID. Donc, la réponse, c'est oui en ce qui a trait aux sommes qui ont été allouées aux 260 organisations dans le volet de mon propre ministère. Il y a beaucoup d'organisations, dont celle que j'ai visité hier, qui traitent directement et qui font l'accueil de femmes et d'enfants dans une situation de violence. Et donc, la réponse est oui.
Merci. Prochaine question. Next question.
Once again, please press star 1 if you have questions. De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toute question. La question suivante, the next question is from Teresa Wright from the Canadian Press. Please go ahead. La parole est à vous.
Good morning, Minister. I just want to follow up with one of the questions from one of my colleagues in the room about UNDRIP legislation. I know you mentioned that you want to pass it in the shortest time frame possible, but your government promised to pass it by the end of 2020. So are you still able to commit to that time frame?
Thank you, Teresa. Our commitment to passing UNDRIP, to introducing the legislation remains. And again, I can't speak. It is Minister Lametti that would be the lead, and I would encourage you to ask him that question. It remains and will remain the top priority of the government as well. Not only the passage of the legislation and the introduction of the legislation, and we've heard it from every regional and national leadership that is or the top priority, but also it's the reviews of laws and policies that need to be put into effect, which are ongoing. Again, the challenges that I would highlight again that I made to your colleague are such that we have a parliament that is operating under rules that are dictated by all the parties, so that we could agree to have the format to combat COVID. It is and remains a top priority of this government to introduce it within that time frame.
But do you think that COVID is going to delay the possibility of it passing before the end of 2020, as was the commitment?
Look, I can't predict what the impact of another wave of COVID would do. I think we've all been proven right or wrong, depending on our own perspectives as to how we see this virus evolving. If it is the case that we need to remain in a certain situation with respect to Parliament, we will have to do so, ensuring that the safety and health of everyone in the House, as well as showing examples to all Canadians. But I think we're all learning with the reopening of the economy that what we think works sometimes doesn't, and what doesn't work sometimes works. But we continue to monitor the situation closely. It remains a priority, but I think it would be, for me, Teresa, I think it would be careless to speculate about a promise that was made. I believe firmly that it is a promise that we can keep. Again, it depends on a lot of factors that I don't control.
Thank you. There are no more questions registered at this time. Nous n'avons plus de questions pour le moment. I would now like to turn the meeting back over to the floor. J'aimerais maintenant retourner la parole à la salle.
Ceci met fin à la conférence de presse aujourd'hui. Merci. Thank you. This ends today's press conference.